Hello, and welcome back. I'm Dr. James, and this is the Whistleblower Physician channel. Today we're tackling something most doctors won't talk about: the connection between your hormones and your eyesight. Here's the myth we've all been fed. You hit 45, your eyes get worse, by reading glasses. That's just aging. Wrong. Blurry vision at 52 might not be about getting older at all. It might be about hormones crashing. And I can prove this using research from Harvard Medical School. Let me introduce Dennis. He's 64, a retired police officer from Minnesota. 7 years ago, his vision got cloudy. His eyes felt like sandpaper. He assumed it was age. His eye doctor said, "You're at that age." Nobody connected what was actually happening. His hormones were crashing, and it was destroying his vision. Today, I'm walking you through how estrogen decline directly damages your cornea. Why dry eyes aren't just uncomfortable, they're a messenger. And most importantly, what you can do about it. This is education, not medical advice. Never stop any medication without consulting your doctor. Here's what Harvard discovered. When estrogen drops below a certain threshold, your cornea loses elasticity. Think of it like a leather jacket. Soft and supple when hydrated. Stiff and cracking when dry. Your cornea is the same. Estrogen maintains moisture. Lose the estrogen, lose the moisture, and light bounces differently. You're seeing through frosted glass instead of clear glass. The frustrating part? This is completely reversible in most cases. Not with surgery. Not with new glasses. But with understanding what's happening in your body. Within 3 months of proper treatment, Dennis's vision cleared completely. No new glasses. No surgery. Just his body getting what it had lost. Now, estrogen isn't one thing. It's a family of molecules. E1, E2, and E3. Estrone, estradiol, and estriol. Most doctors only think about one of them, or they avoid hormones entirely. They hand you a standard dose of synthetic hormones made from pregnant horse urine and hope for the best. Here's why that's backwards. Estrogen breaks down into metabolites. Some metabolites are protective. Some cause inflammation. Your conventional doctor never measures this. They just guess. It's like a mechanic never looking under the hood, just listening to your engine noise. Let me talk about dry eyes specifically. In traditional Chinese medicine, the liver opens into the eyes. And the liver detoxifies hormones. If you're taking hormones but your liver is overburdened, the hormones back up in your bloodstream. They cause inflammation. Your eyes inflame first. That's why Dennis's eye doctor couldn't help him. The problem wasn't his eyes. It was his liver's ability to process hormones. This is the thinking that separates conventional medicine from functional medicine. Your eye doctor sees your eyes. Your primary doctor sees your blood pressure. Your gynecologist might see your hormones. But nobody sees you as one integrated system. That's your job. Most of what you read about menopause online is incomplete. It starts with perimenopause, that transition before your periods actually stop. This can last 3 to 10 years. Your ovaries make less estrogen and progesterone, and your body creates wild fluctuations while adjusting. Some months are normal periods, other months you skip. Your mood swings. Your sleep changes. Your vision fluctuates. This is what Dennis experienced. He didn't know it was hormones. He thought he was going crazy. He thought his body was falling apart. The truth is, his body was communicating. And nobody had taught him how to listen. Estrogen does something critical your body needs. It maintains cellular moisture. Your cornea needs moisture to stay flexible. Your joints need it to stay lubricated. Your skin needs it. Your entire body needs it. When estrogen drops, everything starts drying out simultaneously. Hot flashes and night sweats are obvious. But your eyes are also drying. Your skin is thinning. Your joints are getting stiff. These symptoms often start in the 40s, years before anyone mentions menopause. Think about a 45-year-old woman with blurry vision. The eye doctor says, presbyopia develops at your age. That's partly true, but it's misleading. Not all 45-year-old women have the same vision problems. Some have it at 40. Some not until 55. That variation is hormonal, not age-related. Your age is a number. Your hormonal status is the reality. This is where health education fails you. You're taught that aging is inevitable. That decline is normal. But Dennis proved something different. He got his health back not by accepting decline, but by understanding what system was actually broken. Here's a myth about doctor monitoring. You think your doctor is carefully tracking your hormones? They're not. Standard blood tests are crude. It's like understanding a symphony by hearing 3 random notes. You might hear something important, but mostly you get noise. The right way to measure hormones is through 24-hour urine collection. Specific labs that understand hormone metabolites. Hormones fluctuate throughout your day in blood. But what matters is what your body is actually doing with those hormones. Your blood test doesn't tell you that. Your urine test does. This is why women go on hormone therapy. Their doctor checks blood levels, says everything's fine, and they still feel terrible. The doctor is measuring the wrong thing in the wrong way. Dennis eventually got this right. He found a practitioner who measured his metabolites properly. She explained he wasn't just deficient in estrogen, he was also depleted in progesterone, testosterone, and DHEA. These aren't just sex hormones. Progesterone helps you sleep. Testosterone builds muscle and supports cardiovascular health. DHEA protects your immune system. When all of these decline together, which happens to men after 60, your whole body changes. Your eyes are among the first tissues to show it. Here's something your doctor didn't tell you. The form of hormone matters as much as the type. Oral estrogen you swallow, causes inflammation. It raises C-reactive protein, a marker of systemic inflammation. That inflammation travels throughout your body, including to your eyes. This is why Dennis's vision got worse when he tried standard hormone replacement. His doctor gave him oral estrogen. It was synthetic. Standard dose. But it made his eyes worse because he was adding inflammatory compounds to his system. The solution isn't avoiding hormones. It's using them correctly. Bioidentical hormones, meaning the exact molecular structure your body naturally produces. In the right form. In the right dose. With proper monitoring. For men like Dennis, this meant transdermal testosterone, not oral. The form matters profoundly. Now listen to this. Dennis didn't just get hormone support. He got a complete evaluation. His liver function. His thyroid function. His nutritional status. His inflammation markers. All of it was assessed and optimized. Within 3 months, his vision started improving. His energy came back. His sleep improved. His mood stabilized. His doctor couldn't explain any of it. Dennis knew exactly what had happened. His entire system was being addressed. This is education, not medical advice. This is showing you how your body works. Once you understand this, you can't go back to accepting that aging is the only explanation for decline. Let me walk you through exactly what happens in your cornea when estrogen drops. Your cornea is the clear dome at the front of your eye. It's not just clear, it's flexible. Light enters through it, bends, travels through your lens, and focuses on your retina. If your cornea becomes stiff or scarred or cloudy, light scatters and your brain receives a blurry image. Estrogen maintains corneal elasticity through multiple mechanisms. First, it regulates tight junctions between cells that line your cornea. These junctions hold water inside the tissue. When estrogen drops, these junctions loosen. Water leaks out. Your cornea dries and becomes stiff. Second, estrogen triggers production of mucins, gel-like proteins that coat your cornea and keep it moist. When estrogen drops, mucin production drops. Your tear film becomes thinner and breaks apart faster. You blink, and instead of fresh tears, you've got dry spots. Third, estrogen affects meibomian glands at your eyelid edge that produce oil. That oil floats on tears and keeps them from evaporating. When estrogen drops, these glands inflame and clog. They stop producing oil. Your tears evaporate faster. So you've got three systems failing simultaneously. Loose junctions, reduced mucins, dysfunctional oil glands. Your eye doctor says, you have dry eye. Use these drops. Those drops are temporary. If the cause persists, you'll use more and more drops. That's not a solution. That's dependency on symptom management. Now, dry eye disease is common. But it's not all hormonal. Screens cause it. We look at computers 8 hours daily. Less blinking means less tear distribution. Environmental factors cause it. Air conditioning, heating, low humidity. Some of it is autoimmune. Your immune system attacks tear glands. That's Sjogren's syndrome. But here's what research shows. In women during perimenopause and menopause, dry eye increases dramatically. When those women get hormonal support, their dry eye improves. That's not coincidence. That's causation. For men like Dennis, testosterone helps maintain oil glands in your eyelid. DHEA supports mucin production. Growth hormone supports cellular repair. When all of these decline, which they do in men over 60, dry eyes become common. But it's attributed to age, not hormone status. Dennis had all of this. Declining testosterone. Declining growth hormone. Declining DHEA. And dry, blurry eyes. His eye doctor had no framework to understand the connection. His primary doctor had no framework either. Well, actually, let me rephrase. They didn't even treat the symptom well. They told him to use artificial tears and accept it. They didn't mention there might be an underlying system he could address. This is the critical failure of conventional medicine. Not that it's bad. But it's fragmented. Your eyes are seen by an ophthalmologist. Your hormones are seen by an endocrinologist, if you get to one. Your overall health is managed by a primary doctor with 15 minutes to see you. Nobody connects the systems. Your hormones affect your liver, which detoxifies them. If your liver is sluggish, hormones back up in your system, causing inflammation everywhere, including your eyes. Your hormones affect your thyroid. If your thyroid is low, your metabolism slows. Your body can't repair tissues efficiently, including corneal cells. Your hormones affect your gut. If your gut is inflamed, you can't absorb nutrients. If you can't absorb omega-3 fatty acids, your tear film becomes deficient. Omega-3 is crucial for healthy tears and corneal cells. This is why Dennis's story matters. He didn't just get hormone support. He got complete evaluation. His liver function. His thyroid function. His nutritional status. His inflammation markers. His sleep quality. His stress levels. All optimized. Within 8 weeks, his vision started improving. But it wasn't hormones alone. It was the entire system being addressed. Now, let's talk about blood testing versus urine testing for hormones. This matters profoundly. Blood tests measure hormones circulating right now. But hormones fluctuate throughout the day. A woman in perimenopause might have normal estrogen at 8 a.m. and low estrogen at 3 p.m. A single blood test gives a snapshot, not a movie. Urine tests collected over 24 hours tell a different story. They show what your body is actually doing with those hormones. Are you producing enough? Are you metabolizing properly? Are the metabolites protective or inflammatory? This test changed everything for Dennis. His 24-hour urine showed testosterone declining significantly. But it also showed DHEA production critically low. It showed cortisol patterns abnormal, indicating chronic stress. It showed he wasn't producing enough of the protective DHT from testosterone. He was producing mostly inflammatory forms. This information changed everything. His practitioner could now target support not just to increase testosterone, but to support specific metabolic pathways, creating protective metabolites and fewer inflammatory ones. This is precision medicine. Not guessing. Not using standard doses. But measuring, understanding, and customizing based on what's actually happening. Now, the difference between bioidentical and synthetic hormones. This is fundamental. Synthetic hormones like conjugated equine estrogens come from pregnant horse urine. Literally. They extract hormones from pregnant horse urine and give them to humans. These hormones are not identical to human hormones. They're chemically close but not exact. Your body recognizes them as somewhat foreign. These synthetic hormones increase inflammation markers like C-reactive protein. They increase blood clotting risk. They increase stroke risk. This is from the Women's Health Initiative study that shocked the world in 2002 when it was stopped early. Bioidentical hormones are compounded in pharmacies from plant sources, usually wild yam or soy. Through chemical synthesis, they're converted to the exact molecular structure your body produces. Estradiol from bioidentical prescription is identical to estradiol from your ovaries. But here's the critical part most practitioners get wrong. The form matters. The dose matters. The monitoring matters. Many practitioners give these hormones in problematic ways. Oral estrogen goes through your liver and causes inflammation. Progesterone not as sustained release means levels spike and crash. Topical creams applied to skin, and hormone accumulates in fatty tissue instead of being absorbed properly. They don't monitor with the right tests. This is why Dennis needed the right practitioner. Someone who understood nuances. Someone who measured properly. Someone who knew that more isn't always better. The goal isn't high hormone levels. The goal is optimal hormone function. For Dennis, this meant bioidentical testosterone in cream form applied to mucosal tissue. Bioidentical DHEA in liposomal form for better absorption. Supporting his liver so he could properly metabolize hormones. Adjusting sleep because sleep is when your body repairs corneal cells. Addressing inflammation that was damaging his cornea. Within 3 months, his morning cortisol normalized. His testosterone and DHEA came into healthy ranges. His inflammation markers dropped 47%. His tear film stabilized. His vision cleared. His energy came back. But understand this. This isn't a quick fix. It's restoring function to systems declining for years. It took Dennis about 6 months to feel fully optimal. Changes started within 3 weeks. His eyes didn't feel gritty in the morning. He could read without strain again. Now, your doctor probably won't know about this. If you mention it, your doctor might dismiss it. Your doctor might say bioidentical hormones aren't proven. That's false. There are hundreds of studies. They consistently show benefits for symptoms and safety profiles superior to synthetic hormones. Your doctor might say there's not enough research. That's also false. Harvard Medical School has published on this. Mayo Clinic has published on this. Research shows benefits for vision, bone density, cardiovascular health, cognitive function, and quality of life. What there isn't is a major pharmaceutical company funding huge trials because they can't patent bioidentical compounds. These compounds already exist in nature. No company funds research they can't make exclusive profit on. This is important insight. Big Pharma doesn't fund research on treatments they can't sell exclusively. So if treatment isn't profitable, research often doesn't happen. That doesn't mean treatment doesn't work. It means financial incentive isn't there to prove it. Dennis understood this. His doctor wasn't being malicious. His doctor was working within the system he was trained in. A system that doesn't see hormonal optimization as treatment. A system that sees declining hormones as normal aging. But Dennis wanted more than symptom suppression. He wanted function restoration. And that requires a different framework. Let me walk you through the specific symptoms indicating hormones might be affecting your eyes. The most obvious symptom is blurry vision that comes and goes. Not gradual blurring over decades. But vision clear some days and fuzzy other days. This fluctuation is the hallmark of hormonal influence. Your hormones are fluctuating, and vision is fluctuating with them. Dry eyes are the second major symptom. Actual dry eyes, not just feeling like you need moisture. Grittiness. Redness. That feeling of sand in your eyes when you wake up. Needing drops multiple times daily just to feel comfortable. Some people experience floaters appearing and disappearing. Floaters are tiny particles in your vitreous, usually harmless protein clumps. But some people report floaters changing with their cycle or hormonal status. This suggests corneal inflammation driven by hormones. Light sensitivity that fluctuates. Bright light bothers you some days but not others. This often indicates corneal inflammation. Eye strain that's worse at certain times. Your reading and your eyes get tired faster than they should. This is also hormone-driven because estrogen maintains the muscles controlling your lens. Now, there are other hormonal symptoms accompanying visual changes. Weight gain appearing suddenly or resisting normal diet and exercise. Hormones regulate metabolism. When they decline, metabolism slows and you gain weight more easily. Sleep disruption is huge. You either can't fall asleep or wake at 2 a.m. and can't return. This is the most common hormonal symptom. Sleep is when your body repairs tissues, including corneal cells. Disrupted sleep makes visual problems worse. Mood changes seeming disproportionate to what's happening. You're not necessarily depressed, but irritable, anxious, more emotional than usual. These are classic hormonal symptoms. Hot flashes often bring women to the doctor, but hormonal imbalance can exist without them. Some have night sweats without hot flashes. Some have neither but have all the other symptoms. Don't assume absence of hot flashes means your hormones are fine. Joint pain appearing from nowhere. Especially knees, hips, shoulders, lower back. Estrogen maintains cartilage. When it drops, inflammation increases and cartilage breaks down faster. Brain fog. That cloudy thinking feeling. You can't remember words. You can't focus. You lose your train of thought. Progesterone supports cognition. Estrogen protects neural tissue. When these drop, cognition declines. Hair loss or thinning. Hormones regulate hair growth cycle. When they decline, hair becomes thinner and falls out more easily. Loss of libido. Testosterone drives sexual desire in both men and women. When testosterone drops, so does interest in sex. Now here's what's interesting. Dennis experienced most of these. Blurry vision and dry eyes most obvious. But also joint pain, sleep disruption, and brain fog. He dismissed all of it as aging. He thought 64-year-old bodies just felt like this. But when his hormones were optimized, everything improved. His vision cleared. His joints stopped aching. His sleep became deep and restorative. His thinking became sharp again. This tells you something important. These aren't separate diseases. They're not random symptoms. They're all expressions of the same underlying system declining. When you address the system, you address all the symptoms. Now, let's talk about the relationship between your hormones and your thyroid. And between your thyroid and your vision. Your thyroid is a gland in your neck producing hormones regulating your metabolism. But it does so much more. Your thyroid hormones affect every cell including your eye cells. When your thyroid is underactive, called hypothyroidism, everything slows. Including cellular repair processes in your cornea. Here's the problem. Most doctors only test TSH when checking thyroid. TSH is a pituitary hormone telling your thyroid what to do. It's not actually a thyroid hormone. It's like measuring how hard you're pressing the accelerator instead of measuring how fast the car is going. You need a full thyroid panel. Free T4. Free T3. Reverse T3. Thyroid peroxidase antibodies. Thyroglobulin antibodies. If you've only had TSH tested, your thyroid hasn't been properly evaluated. And here's what's critical. Estrogen affects thyroid hormone metabolism. When estrogen drops, your thyroid function can change. You might develop hypothyroidism that wasn't there before. Or if you already had it, it can worsen. This matters for vision because slow thyroid means slow cellular repair. Your cornea cells aren't being repaired efficiently. You're accumulating damage. Your vision declines. Dennis had never had his thyroid properly tested. When he finally did, his free T3 was low and reverse T3 was high. This indicated his thyroid hormones weren't being converted properly into the active forms his cells could use. Part of his treatment involved addressing both his overall hormonal status and his thyroid-specific issues. Within 2 months of optimization, his thyroid function improved. His energy came back. His metabolism started working better. His vision continued improving because his cellular repair processes were operating at higher levels. This is systems thinking. Connecting dots that your conventional doctor never connected. Now, how do you know if what you're experiencing is hormonal or something else? The answer is you might need both conventional and specialized care. If your vision problem came on suddenly, it might be something acute needing immediate medical evaluation. Sudden pain. Sudden loss of vision in one eye. These are emergencies needing conventional care immediately. But if your vision problem came on gradually and fluctuates with your cycle or seasonal changes or stress levels, it's likely hormonal. If your eye doctor found nothing structurally wrong but your vision is still blurry, it's likely hormonal. If your symptoms improved when you were pregnant, that's a huge clue because your hormones surged during pregnancy. If your vision problems accompany the other symptoms we've mentioned, joint pain and sleep disruption and brain fog and mood changes, it's almost certainly hormonal. In that case, you need a practitioner specializing in hormonal optimization. This might be a naturopathic doctor trained in hormone metabolism. A functional medicine doctor. An integrative medicine doctor. A gynecologist specializing in bioidentical hormone replacement. An anti-aging medicine specialist. What you're looking for is someone measuring hormone metabolites, not just blood hormone levels. Someone understanding the difference between synthetic and bioidentical hormones. Someone understanding liver support when using hormones. Someone with extensive experience and good clinical outcomes. How do you find someone like this? Ask around. If you know anyone who's had success with hormonal optimization, ask who they worked with. Check online reviews but be skeptical. Ask about credentials. Ask about experience. Ask about their monitoring approach. The right practitioner will want comprehensive testing before starting anything. They'll want to understand your full health picture. They won't just give standard doses and send you away. Dennis found his practitioner through referral. A friend had worked with her for thyroid issues and recommended her. She had training from Harvard Medical School in metabolic medicine. Dennis knew he was in good hands. Now, let me address cost. Bioidentical hormone optimization isn't cheap. Initial evaluation might cost $500 to $1,500. Testing might cost $500 to $2,000. Compounded hormones might cost $100 to $300 monthly. Follow-up visits and retesting might cost another $200 to $500 every few months. This isn't covered by insurance usually. It's out of pocket. This creates access issues. People who can't afford this don't get access. But here's what matters. Many people are already spending this much managing symptoms. Expensive glasses every few years because vision is changing. Eye drops. Multiple medications for joint pain, sleep problems, mood issues, all driven by the same hormonal decline. Missing work or losing productivity from symptoms. The actual cost of not addressing the root cause is often as high or higher. Dennis calculated this. In 5 years before proper treatment, he'd spent about $8,000 on eye care, glasses, and drops. About $3,000 on pain management. About $2,000 on supplements he was trying. Plus lost income from days he couldn't work. The real cost of untreated hormone decline was substantial. The cost of proper diagnosis and treatment, done over 9 months, was about $6,000. Less than he'd been spending on managing symptoms. And with far better outcomes. This is worth thinking about if you're considering this path. Now, can this help everyone? No. If you have structural damage like severe corneal scarring or advanced macular degeneration, hormonal optimization won't reverse that damage. Once tissue is destroyed, it's destroyed. But it can prevent further damage. And improve function even with some damage present. For example, someone with early cataracts might slow progression with hormonal optimization. But won't reverse fully formed cataracts. Someone with dry eye disease can often get complete resolution with hormonal optimization. But if tear glands themselves are damaged from autoimmune disease, progress might be slower. This is why detective work is important. You need to understand what's actually causing your symptoms. Because that determines what treatments will work. For Dennis, blurry vision and dry eyes were caused by hormone-driven changes in his cornea and tear film. There was no structural damage. So hormonal optimization fully resolved his symptoms. If he'd come to treatment after developing scarring from years of untreated dry eyes, his outcome would have been better than without treatment, but not as complete. This is why early recognition matters so much. You want to catch this before permanent damage occurs. Which means you need to know what symptoms to watch for and what they mean. And now you do. Let me talk about the practical side. How do you actually start exploring hormonal optimization? The first step is getting a baseline. You need to know where you are. This means comprehensive testing. Not just TSH and basic metabolic panels your regular doctor runs. But specific hormonal testing through urine collection. Full thyroid panels. Inflammatory markers like high-sensitivity C-reactive protein. Complete metabolic panels assessing liver and kidney function. Some practitioners will test sex hormone-binding globulin, a protein carrying hormones in your blood. This affects how much hormone is available to your tissues. They might test insulin, because insulin affects hormone metabolism. They might test cortisol patterns throughout the day, because stress hormone status affects sex hormone metabolism. This testing can seem extensive. But it's giving you a map of your situation. You can't fix what you haven't measured. Dennis's initial testing took about 4 weeks. urine collection, blood work, saliva testing for cortisol patterns. Then his practitioner reviewed results and created a customized plan. The second step is lifestyle assessment. Your hormones don't exist in a vacuum. They're affected by sleep, stress, what you eat, how much you move, toxin exposure. A good plan includes all factors. Dennis's practitioner looked at his sleep. He was sleeping about 5.5 hours nightly and waking frequently. That's not enough. When you sleep less than 7 hours, cortisol stays elevated, suppressing sex hormone production. So sleep optimization was first. Better sleep hygiene. Supplemental magnesium. Adjusted schedule for more sleep. She looked at his diet. He was eating processed foods regularly. Industrial seed oils. Lots of sugar. These drive inflammation, which drives hormonal imbalance. So his diet changed. More whole foods. Healthy fats. Plenty of vegetables. Omega-3 supplementation to address inflammation. She looked at his exercise. He was doing too much high-intensity exercise and not enough recovery. This kept cortisol elevated, suppressing sex hormone production. So his exercise changed. More walking. More gentle yoga. Resistance training but not excessive. Plenty of recovery days. She looked at his stress. He'd spent 32 years as a police officer dealing with high-stress situations. He'd retired but carried that stress pattern. So stress management became part of the plan. Meditation. Breathing exercises. Journaling. Therapy to process career trauma. She looked at environmental toxin exposure. Many chemicals mimic hormones and disrupt normal signaling. So he changed to organic foods where possible. Got rid of plastic containers for glass. Changed to natural cleaning products. Avoided fragrances in personal care products. All of this matters. Hormones operate in the context of your total health. You can't just add hormones expecting good outcomes if everything else is dysfunctional. The third step is starting treatment gradually and carefully. You're not taking standard doses. You're taking very low starting doses. Then you live with that dose for several weeks and assess. Do your symptoms improve? Do you develop side effects? How does it feel? For Dennis, this meant starting with very low testosterone in cream form applied to his scrotum, which has highly permeable skin. He was started with 12.5 milligrams every other day. That's very low. Most would say too low to have effect. But it does. And it lets you see how your body responds. After 3 weeks, Dennis reported his morning eye grittiness had improved. His morning cortisol seemed lower. So the dose was increased slightly, to 12.5 milligrams daily. Another 3 weeks, and his vision was noticeably clearer. No further increase yet. He continued at that dose. After 6 weeks, retesting showed his testosterone metabolites in better ranges. At this point, a small amount of DHEA was added. Very low dose. Just 5 milligrams daily. Sublingual in liposomal form for optimal absorption. After 3 weeks on DHEA, he reported further improvement in energy and clarity. Another retest was done. His inflammatory markers were coming down. His metabolites moving in the right direction. This measured, gradual approach is critical. It lets you see what's actually helping. It lets you avoid overshooting and creating problems. It lets you optimize without disrupting. By week 16 of treatment, Dennis was at 25 milligrams of testosterone daily and 5 milligrams of DHEA daily. His symptoms were dramatically improved. His vision was clear. His joint pain almost completely resolved. His sleep was deep and restorative. His mood was stable. His energy excellent. At that point, a retest was done confirming everything was in healthy ranges. Then the plan transitioned to maintenance. He would continue these doses. Retest every 3 to 6 months. Continue lifestyle modifications. Monitor symptoms and report back if anything changed. This is a 9 to 10 month process from initial testing to stable maintenance. That might seem long. But it's time well spent. You're not guessing. You're measuring. You're adjusting based on data. You're optimizing rather than just treating. Now, something that often surprises people. Improvement in vision often isn't the first symptom that improves. For Dennis, it was his eyes feeling less gritty. For others, it might be sleep improving first. For others, joint pain. For others, energy or mood. This makes sense. Different tissues respond at different speeds. Your eye surfaces are constantly exposed to environmental stress. So they take a while to heal. Your nervous system is extremely responsive to hormonal changes. So mood and sleep often improve first. Your joints have slower blood flow and slower repair. So they take longer to heal. But they all improve with patience and proper treatment. Dennis got his clearest vision about 12 weeks into treatment, and it's remained clear since. His other improvements have been stable and progressive. Each month he notices another small refinement. Night vision better. Ability to focus on screens for long periods better. Visual processing speed better. All of this is happening because his body's repair systems are finally operating optimally. Now, can you stay on hormones long-term safely? Yes, but with proper monitoring and with bioidentical hormones. Research on bioidentical hormone therapy shows excellent safety profiles when properly dosed and monitored. The 2002 study that scared everyone was about synthetic hormones, not bioidentical. Women on bioidentical hormones had different outcomes. But it requires monitoring. You can't start hormones and then ignore them for years. You need regular retesting. You need regular symptom reassessment. You need someone tracking your health markers. This is ongoing care, not one-time treatment. Dennis accepted this. He understands that maintaining optimal hormone function is part of maintaining his overall health. He takes his hormones daily. He retests every 4 months. He reports symptoms to his practitioner. He adjusts his lifestyle as needed to support hormonal health. In exchange, he has clear vision. He has pain-free joints. He has stable mood and energy. He has good sleep. He has the vitality of someone in their 50s, not their 60s. For him, that trade-off is excellent. Now, let me talk about something on your mind. Cost and access questions. Bioidentical hormone optimization isn't cheap. But many people are already spending this much managing symptoms. Expensive glasses every few years. Eye drops. Multiple medications for pain, sleep, mood, all driven by the same decline. Missing work due to symptoms. The actual cost of not addressing the root cause is often as high or higher than proper treatment. This is becoming more accessible. More practitioners are trained. Telemedicine has made it geographically available. Online communities are forming. More functional medicine doctors are adding this. If you're interested, you don't need someone in your immediate area. You can work with practitioners remotely. You can do testing locally and send results electronically. You can have follow-up visits via video call. Dennis's practitioner is based on the East Coast, but Dennis is in Minnesota. They communicate via video and email. He does testing through local labs and sends results electronically. How do you find a quality practitioner? Ask in online functional medicine communities. Check ACAM, the American College for Advancement in Medicine. Check ANP, the American Association of Naturopathic Physicians. Look for someone with specific training in hormone metabolism. Look for someone who publishes or teaches in this area. Look for someone with multiple years of experience. Look at patient testimonials and outcomes. And be willing to have a consultation before committing. A good practitioner will spend time understanding your situation before proposing treatment. They'll explain their approach. They'll answer your questions. They'll make sure you're comfortable before you start. Dennis had 3 consultations before choosing. He wanted to make sure she understood his situation. He wanted to make sure her philosophy aligned with his. He wanted to make sure she had the expertise he needed. And he found the right person. Now, returning to the central point. The reason I've spent this time is because hormonal optimization works. And it's completely underrecognized. Your eye doctor isn't going to tell you about this. Your primary doctor isn't going to tell you about this. You might never hear about this unless someone who's experienced it tells you. But once you understand the connection, it makes perfect sense. Your eyes are tissues. Tissues need hormones. When hormones decline, tissues decline. When you restore hormones, tissues restore. This applies to so much more than vision. Your brain needs hormones. Your heart needs them. Your bones need them. Your entire cardiovascular system needs them. Your immune system needs them. Your gut needs them. When you optimize hormones, you optimize your entire body. Dennis is proof. He got his vision back. But he also got his energy back. His joints back. His sleep back. His mental clarity back. His life back. And it's all because he understood that a symptom isn't something to suppress. It's a message from your body that something needs attention. When you follow that message to its source and address the actual problem, everything changes. This is the path to real health. Not symptom suppression, but system restoration. Now, finally. This information is educational, not medical advice. You need to work with a qualified practitioner to determine what's right for your situation. And do this with full informed consent. You need to understand risks and benefits. You need to understand the monitoring required. You need to understand the long-term commitment. But if you're experiencing blurry vision, dry eyes, joint pain, sleep problems, mood changes, brain fog, and your conventional doctors haven't been able to help, then exploring hormonal optimization is absolutely worth your time. The science is sound. The mechanism is clear. The outcomes, when done properly, are excellent. Dennis's clear vision is your roadmap. That can be you too. Here's what I want you to do next. First, assess your symptoms. Do you have any of the signs we talked about? Make a list. When did they start? How have they progressed? What makes them better or worse? Second, document your health history. Write down significant health events. Surgeries. Diagnoses. Medications. Supplements. Family history. This will all be important information for a practitioner. Third, start looking for a qualified practitioner if this resonates with you. Don't rush. Do your research. Have consultations. Find someone you feel confident with. Fourth, start making basic lifestyle changes now. Better sleep. Cleaner diet. Regular movement. Stress management. These support hormonal health regardless of formal treatment. Fifth, remember this. You have agency over your health. You don't have to accept decline as inevitable. You don't have to accept that getting older means getting sicker. You can actively optimize your health. You can measure. You can adjust. You can restore function. This is the future of healthcare. Not waiting for disease and then treating it, but measuring health markers and optimizing them before disease develops. This is precision medicine. This is preventive medicine. This is the kind of medicine that actually works. Dennis embodies this. He didn't wait for complete vision loss. He caught the decline early. He investigated the cause. He addressed it systematically. He got his health back. Your story can be the same. It all starts with understanding that your symptoms are messages. And then having the courage to investigate what they're trying to tell you. I'm rooting for you. And I'll be right here with more information to help you on your health journey. See you next time with even more life-changing information.